conversation goes back to 2018. Dr. Bayo referred to a conversation I had with him right on this program when Dr. Nsiasa gave the directive. And Dr. Bayo has spoken about things he said and I said around, if you don't fix the system, you are not going to get outcomes, irrespective of the procurements you make. Yes. I have said, if you look at Ghana, our health expenditure, the government's component doesn't even leave less than 5% for them to buy equipment, for them to do maintenance of equipment, and for them to do training. I've got a detail in an article that I've given to Samuel Dami. You can go and have a look at it. We don't have the space. So if you're telling me someone died because there was not a defibrillator, and I listened to Enima read a response from a pediatrician who was being a carpenter at one point, being a plumber at another point, and I asked myself, you know what? What have we been doing since 2018? Dr. Zakaria was very candid, and I really respect him for that. But the truth of the matter is our population is growing at 2.2% per annum. Our health expenditure per capita and our total health expenditure is dropping by 0.13% per annum since 2017. How can you plan for healthcare when your population is growing and your health expenditure as a percentage of your GDP is in the negative? You see, and these are some of the things that we need to address. We need to have an honest conversation. Like Dr. Bayo said, you can put a surgeon on standby to go somewhere. How many surgeons are we training? What is our doctor to population ratio? How many doctors do we have per our population? What is the plan to plug the gap? Are we going to continue having the conversation? Oh, when I was in power, I employed X amount of doctors. I did better than you. You employed X amount of nurses. You did better than me. Or we're going to say, this is our deficit. What is our plan to fix it in the next 5 to 10 years? Alternatively, if we cannot fix it in the next 5 to 10 years because we don't have the training capitalization, what can technology do? How can technology come in, like Dr. Bayo said, to work out the bed occupancy, to work out the transfers for us, to decouple our outpatient departments from our secondary and tertiary care so that the doctors in there can have a lot less on their hands and deal with these high specialist care. Look, the truth of the matter is we are not thinking. And people don't want to hear this simple truth. But if anyone wants to, they can go on my Facebook wall and read, and you see how we are not thinking. We have stopped thinking about healthcare because we see healthcare not as a driver of our socioeconomic development, but a depletion because we have to pay the health personnel, train them, and pay for the health facilities. And that doesn't augur well for us.
I want to thank you both for your time with us, Dr. Titus Bayo